Transparency, governance, and accountability are core values of the Presidential Task Force on COVID-19 since its inception. The task force has continued to ensure that Nigeria's COVID-19 response reflects these values, especially in the face of scrutiny, mis- and disinformation of the PTF's activities in response to COVID-19 pandemic, and to mobilize resources to match the gaps and need for eradicating coronavirus. And the PTF, in its continuous engagement with the private sector and donor community, is launching 2 transparency dashboards. The first is Incidence Response Tracker Dashboard, developed by the Nigerian Economic Summit Group and funded by the Africa Initiative Governance. And the second is COVID-19 Resource Tracking Dashboard, developed and funded by the United Nations Development Programme. So joining us now from London, England, to explain these packages is Ofovwe Aig-Imoukhuede, Vice Chairman, African Initiative for Governance. It's a pleasure having you on the program, Ofovwe. We'll just go straight to it. I want you to tell me about these trackers, to be able to monitor what is happening.
It's a pleasure to be here with you this morning. So the Africa Initiative for Governance and the NESG actually jointly developed the Incidence and Response Tracker Dashboard. And what that allows the Presidential Task Force to do is to see the resources that are required to fight the pandemic across the country and to channel the resources in an effective way. So it will indicate the number of equipment that is required, for example, at the contact tracing centers, at the testing centers, at the isolation and treatment centers. It will state, for example, hospital beds, lab equipment, and so forth, the amount that is required, what is in stock, and what the difference is. So right there on the dashboard, you will be able to see exactly what is required across the country. And then the PTF is able to channel the resources effectively. So direct the resources where they're required, when they're required.
Okay, I thought that is what I was going to ask you a question next, but let me come in here. First, this morning we talked about the Nigeria Economic Summit Group. So I guess a lot of people know about the NESG, but now you have this partnership with that group. And many people may not know about Africa Initiative for Governance. I know you are a public sector reform intervention agency, group, NGO. You also give out scholarships. Would you like to tell us a little bit about AIG, the Africa Initiative for Governance, which, if you break it down, is AIG, which is also the first name in your last name. And then you go further and tell us how exactly the dashboard works and how we can engage with that dashboard as trackers too in our own space.
Thank you very much. So the Africa Initiative for Governance is focused on driving public sector transformation. So we are a not-for-profit that believes that until we have an effective public sector, Nigeria is not going to be able to develop to its full capacity. So what we do is we basically provide avenues for transformative leadership to be channeled into the public sector. We are in our 6th year of providing scholarships for promising young Nigerians who are interested in a career in the public sector to get a master's degree in public policy at the University of Oxford School of Government. So this year, we are announcing the scholarships. At the end of this month, people will be able to go on our website and apply for them. Up to date, we have 27 young Nigerians and Ghanaians who have benefited from the scholarship. We also provide capacity building for the public sector existing civil servants. We have a partnership with the Office of the Head of the Civil Service of the Federation, and we're supporting them in their reform initiatives. Currently, we are focusing on digitization. We're helping them to digitize their work processes so that they're able to work from home or wherever in the world they may be. As you are aware, during the lockdown, some civil servants had to stay at home and they weren't able to do work, whereas governments across the developed world were able to continue to do their processes because they had digitized. So our focus on our partnership with the civil service at the moment is helping them to digitize their work processes. In addition, we are about to embark on a very exciting public leaders program launching next year. And what that will do is capacity building for existing mid-level civil servants. So we're hoping that this will be the premier capacity building program for civil servants in Africa.
How does it work? I'd asked you about the dashboard. How does it work? And how can we engage with it as trackers in our own space?
So the dashboard is available for all Nigerians to click on, and the website address is covid-19response.ng. So you go on the dashboard, you create an account, and you will be able to see all the resources that are required all over the country. You can choose specific states and even sectors within the states. So you click on the dashboard by state, for example, and click on a particular locality, and you will see the resources that are available and the resources that are required. For example, ambulances, lab equipment, and so forth. And if you want to donate, you indicate exactly what you want to donate and where you want those donations to be channeled to. So what this allows the government and the public, donor agencies, and so forth, is basically to determine what they want to donate and where they want to send it to. You click on it, you will be able to access the information that will empower you to do that.
The response of this pandemic here in Nigeria is the Center for Disease Control, our own NCDC. How does this dashboard, this tracker dashboard, aid what they do? What is the benefit? You said it's for all Nigerians, but what particular benefits would it provide for the NCDC, for instance, or the Ministry of Health?
So as you know, the rate of COVID differs across the country. States like Lagos and the Southwest have higher incidences at the moment. And what the dashboard allows the NCDC to do is to see exactly what is required where. So rather than just sending the same number of ambulances, hospital beds, equipment, and so forth across the country, they're able to target where they channel the resources in the most effective way. So if more lab equipment is needed in one location, they can see exactly where and target it. So information is key. And this dashboard provides the NCDC, the Ministry of Health, and other development agencies with information that they need to be more effective in the fight against the pandemic.
All right, I just want to know about
the response threshold. You know, in all of this, there's a response threshold. How quick do you respond to this need? Take, for instance, I'll give you an instance. I think the NHS ambulance response threshold, for instance, in England, is about 96, 97%. So what's the percentage response for the needs available? Take, for instance, once I say, oh, there's a need for this, there's a need for that, what's the response like?
Well, what this dashboard does is it provides information for people to respond. So it enables you to look and see what is required. And if you donate, if you say, I need to give 10 ambulances to Jigawa State, for example, our response is absolutely immediate. So the NESG will contact the potential donor and arrange the delivery of the equipment. So what this allows is for people to see what is required and to give. If they indicate that they want to give, we respond very quickly and get in touch with them to arrange for delivery. So it is not up to us, basically, to say, you want to donate, you have indicated you want to donate, donate right now. It's up to the public and donor agencies and the private sector and so forth to be responsive. So we're providing this information to them, and we're asking them basically to join in the fight against the pandemic by donating their resources.
This is in the context of response to the COVID-19 pandemic, and I'm sure you must have been tracking Nigeria's management and response process. Now, what do you think are the basic lessons we should learn or that we need to learn so far, particularly with this talk about easing restrictions, reopening, and things we have seen, lessons we have seen from other jurisdictions about the risks involved?
Well, I think that we have been relatively fortunate in Nigeria that we haven't seen the same number of fatalities that have occurred in other countries, and we are hoping that this continues. What we have seen at AIG is that apart from obviously improving the public health system, there are other things that need to be put in place that will enable the country to fight against future pandemics. We held a webinar recently with our partners, the Blavatnik School of Government at the University of Oxford. And some of the things that came out of that webinar was that we as a country have to use this pandemic as an opportunity to go back to our foundations. Basic services and goods that are not currently being provided to the populace need to be put in place. So we need to look at the way in which we spend, public spending. We need to diversify our economy. Obviously, we need to improve our public health systems, education, and so forth. But most importantly, and this is what we at AIG are focused on, we need to improve our public sector performance. Because when we have an effective public sector performing in the way that it should, then we are able to address any issues, any pandemic, anything that may come our way. The COVID-19 pandemic was completely unexpected, and governments across the world had to quickly sort of ramp up their responses. The governments who were able to respond most effectively were the ones who had a public system that was working effectively. So the one lesson that has come out of this is that we as Nigeria need to go back and look at how our public sector works and put in place the institutions, put in place the structure that will allow us to rapidly respond to any situation that may come in the future.
Response at a time like this, it also addresses the issues of accountability and transparency. How important is what you do? And let me ask you, because just yesterday we had the governor of Kaduna State say, 400,000 is being spent on a COVID patient. We had controversies around the amount of treatment, even when the Lagos State government released its own figures. What sort of collaborations did you make? How do you interrogate these donations, the spendings, and these targeted responses?
So we don't necessarily interrogate exactly what the government spends. What we are fighting for is a system that provides information to the public so that they can interrogate. Transparency and accountability at the heart of good governance, and information is key to that. Now, if we have a digitized public sector, all that information will be out there for everyone to see, and the public will be able to engage with it and question the government and basically hold them accountable. So until we have a digitized public sector that is open and transparent, where anyone can go online and see exactly what is being done, as happens across the world, we won't really be able to talk about transparency and accountability in Nigeria. So this is why digitization is key. That's one of the things that the Africa Initiative for Governance is working with the public, with the civil service at the moment to try to implement.
Aig-Imoukhuede, And we wish you all the best with your partnership with the Nigeria Economic Summit Group.